We are going to move with every conceivable speed, capacity, creativity, flexibility to do what we can do. But we need help from the state government. We need help from the federal government. And I'll speak to the federal piece as well, because there really are crucial things that we need from the federal government to make this work. But the bottom line is our healthcare leaders, our healthcare workers are doing the job every single hour of every day. And by the way, there's a lot of people who want the vaccine. There's also people who don't want the vaccine yet. And we need to be aware of that in our plans. And that's okay. If they don't want it yet, we'll get them later. But right now, we want to reach everyone who is ready, willing, and able to get vaccinated. Here to tell you about the efforts of our public health care system. Again, our public hospitals and clinics have been heroic. Our healthcare heroes throughout have sustained us. The investments we made years ago, we put hundreds of millions of dollars into health and hospitals to make it strong well before we ever heard of the coronavirus. Those investments were worthy because our healthcare heroes were there for us. Pleasure to introduce the CEO of Health and Hospitals, Dr. Mitch Katz.
Well, thank you so much, Mr. Mayor. And you know, our staff was so honored when you came. It will be 3 weeks tomorrow that you came to Elmhurst Hospital, and we started vaccinating those healthcare heroes. And we started, as the state has asked, with the people at the highest risk. Those two people, you'll remember, sir, were one worked in the ICU, one worked in the emergency department, where people have breathing tubes, which put people at high risk. Both of them, you'll remember, were over 60.
Yes.
Right, so we started very narrowly. But in these last 3 weeks, I'm happy to tell you we have vaccinated everyone in all 11 hospitals who have patient care responsibilities. So they are protected. They can go and take care of their patients and know that they are not themselves going to fall ill to this illness. Now, starting yesterday, the state gave us approval to vaccinate everybody in the hospitals. So by the end of this week, sir, we are going to vaccinate everybody in the hospitals. All staff who want to be vaccinated, we are going to do it. I was pleased to follow in the footsteps of those two great heroes and get my own vaccine when we opened it up to outpatient doctors. And when I see my patients this Wednesday, because it's been 10 days, I will know that I'm not going to transmit the virus to them, and I can take care of them without the same worry that I'm going to bring home that virus to my family or elderly parents. But there's so much more, sir, that we really want to do. We're going to be starting this week to take care of vaccinating the affiliated, the unaffiliated physicians. Those are the physicians who work so hard in the community. They are often taking care of patients from low socioeconomic areas, the dentists, the physical therapists, the home health care aides, the optometrists. We want to vaccinate all of those people so that they too can do their patient care work without worrying about getting infected themselves or worrying that they are going to transmit this virus to someone else. But I have to say, sir, what will make me most happy is when I can vaccinate my own patients. I have several patients who are over the age of 75 with diabetes and heart disease. I want to be able to vaccinate them. We have the ability to do it at our health centers and our hospitals. We simply need the approval from the state so that we can get going on these other groups. The healthcare heroes deserve to be first. They were at the greatest risk. They gave up, sadly, many of them gave up their lives in order to be able to take care of the patients. But we next want to go to the highest risk people, which we know are elderly persons. I want to be able to do those patients in my patient panel, who I'm the primary care doctor for. I want to do all of the patients of health and hospitals. I know the other hospitals want to be able to offer it to their patients. I think, too, of my 98-year-old father, World War II vet, my 93-year-old mother. I want them vaccinated. We're waiting our turn, of course, but I want that turn to come. And I feel with your leadership, sir, we are ready. We are ready to do those people at greatest risk, and we look forward to working with you in the coming weeks to see them vaccinated. Thank you.